They will tell you of driving restrictions that will last for 3 or 4 weeks. Be sure to write down a name and phone number of who to call for questions or potential problems at home. They will tell you about shoulder stabilization exercises to perform regularly, such as pendulums and grip strengthening exercises to reduce stiffness and swelling and encourage circulation. Get instructions on how and when to set up physical therapy appointments.
10:30.
You are then released from the hospital to your driver to go home. Once you get home, you will probably want to sit down. Head for your favorite chair where you can manage reading, telephone, TV, and nap. Eating with one hand may present some challenges, but sandwiches and salads are easy to handle. It is difficult cutting food because 2 hands are required. Now you can get to put into practice your toilet hygiene activities you learned during your pre-op activities. You will have figured out how to get on and off the toilet and use toilet paper with only your non-involved arm. When showering, cautiously take off the sling. Showering instructions are to keep the shoulder dry for 3 days. After 3 days, you can get the wound wet, but don't wash it. Pat your shoulder dry. Later, wash normally, but only lightly around the involved shoulder, leaving the steri strips on until they fall off. Do not put anything on the wounds. After a while, when some motion is tolerable, shower and washing of hair and face and shaving by bending over and hanging your involved arm below your elbow toward the floor. Put on a shirt by bending over, putting the involved arm into the sleeve first, pants, socks, and shoes. Sometimes patients need a caretaker to help with their socks. Shoulder icing should be done at lunch, dinner, and prior to bed for the first month or so, depending on your doctor's instructions. A long sleeve shirt underneath your shoulder icing apparatus helps keep the skin protected. There are many types of shoulder ice wraps available today. Here are pictures of effective shoulder ice wraps. The key for an icing system is the length of time the ice stays cold enough to be helpful. Shoulder ice wraps take a few minutes to put on at first, but can be done quickly once you know how it goes on and you have it adjusted. And sleeping in a recliner chair with your involved arm elevated can be helpful for the first few days. Sleeping on your side in bed with a large pillow will keep your involved arm elevated, and in a sling, it will be more comfortable. Someone from the orthopedic staff will give you a follow-up call to ask how you're doing. Maintain a list of items and expectations of this follow-up call, including how your shoulder feels, any unexpected pain or symptoms, overall sleep quality and sleep prescriptions needed, requests for additional medications or refills. Be sure to have an appointment to see your surgeon and to know when to see a physical therapist. After surgery for the first month, the goal is early restoration of passive motion and pain-free sleep. Most commonly, patients are instructed in daily passive home exercise program that they perform on their own for the first month. These exercises consist of pendulums. Bend over at the waist, letting the involved arm hang down. Sway your body back and forth to generate small circles with the hand, both in clockwise and counterclockwise directions. These pendulums encourage circulation and help reduce swelling and stiffness.
Okay? To do that, we want gravity and momentum to do the work. Okay?
So for your right shoulder, you want to lean forward and let your right arm hang down and rock your body back and forth. Then stop rocking your body and let your arm come to a stop, like a pendulum. And we can then do that in different directions. You can make circles with your body and then relax the arm and let it stop. You can go side to side and then let the arm stop.
First couple of weeks, you're lifting your involved arm onto the desk will be risky, if not painful. After a week or two, you should be able to lift your involved arm onto the table, bend at the arm at the elbow, and eat or use a computer and mouse. Be mindful when using your involved arm and hand. Damage can be easily done unintentionally to your repaired arm through instinctual dangerous movements. Reacting to falling objects with your involved hand and many other natural reactions must be curtailed while your shoulder is healing. Exercise increases blood flow and stimulates healing. Start lower body exercise using a stationary bike. Walking outdoors is recommended when the footing is sure and dry. Even though you won't be driving for a while, you still must use seat belts. Buckling your seat belts are cumbersome for the first month, even while riding in a passenger seat. Sit back, enjoy being chauffeured around, see the world from your relaxed viewpoint. At 1 month, you'll eagerly return to see your surgeon to authorize physical therapy. This is often required for insurance purposes as well. Again, be sure to choose a nearby therapist for your physical therapy. Follow the instructions of your physical therapist to avoid re-injuring the repaired area during your rehabilitation process. Your surgeon should be in close communication with your physical therapist about the proper protocol following your particular procedure. Your physical therapist will assist you in regaining your range of motion and strength. Continue to utilize ice frequently during this phase to minimize swelling and pain associated with rotator cuff repair whenever aching and soreness is there. Soon you will officially discontinue the sling. Once the range of motion has been restored, your therapist will give you a series of daily exercises aimed at restoring strength and function, thus stimulating the rotator cuff muscles around the shoulder to work together. Continue daily lower body exercise using a stationary bike or walking outdoors. Keep a list of questions and problems you want to address for each of your physical therapy sessions. These sessions are most healing part of the rehabilitation process, both physically and mentally. Driving is possible with your surgeon's permission after 1 month follow-up, when you can comfortably get into the vehicle, fasten your seatbelt, and get 2 hands on the wheel with no sling. Now is the time to visualize and practice basic driving movements before going out on the road. Remember that any quick, instinctual emergency use of your involved shoulder can hurt. Involved right-hand skills that are needed are fastening your seatbelts, turning on an ignition key, shifting, emergency brake, radios, and CD player. With surgery on your left shoulder, toll booths, car tellers, and drive-thrus may be more difficult. Never operate a vehicle while taking narcotic pain medication. For your mental sanity during rehabilitation, maintain an awareness of your post-operative functionings. This can easily be done on a daily basis by simply monitoring the increasing ease of putting on one's socks, pants, shirts, bathroom activities. Each day you will notice these tasks getting slightly easier, thus confirming that progress is being made. The diminishing pain and aches from week to week during your postoperative period provide encouragement and appreciation of the progress you're making during the long rehabilitation process. This awareness will give you good feedback on the healing of your shoulder and will help you avoid postoperative doldrums. Get out those easy activities and projects that you never seem to get around to. 3 months is a major milestone where you should have full active and passive range of motion with good scapular control and adequate strength to perform general activities of daily living, pain-free, and light work-related tasks. The focus during the period of 3 to 6 months is on slowly returning to your prior functional level of activity under the supervision of your physical therapist. Later, you will graduate to active assistive range of motion, shoulder flexibility exercises, start TheraBands, and later you will graduate to active assistive range of motion, shoulder flexibility exercises. Start the elastic TheraBand for your shoulders.
Yeah, that's good, Mark.
You could have some occasional slight pain and inflammation after some exercises. When this happens, use your shoulder icing apparatus a couple times a day until the shoulder is pain-free. Progress is slow, but the rewards of a pain-free shoulder will prove worth the effort. Around 6 months, you'll be discharged from physical therapy once you have full range of motion, normal strength, and resumed full pain-free activity, or your insurance runs out. When walking outdoors, any fall on your involved arm could be devastating. In winter, get a set of traction devices and use them. You don't want to go through this process again. Continue pain-free work and increase intensity in your exercise program, proceeding slowly for the next couple of years to avoid any setbacks. Gradually begin easy athletic activities. Progression through recovery and rehabilitation process is different for each patient. Extent of surgical repair, age, health, and previous athletic activity are big factors in the rate of return to completely rehabilitated normal activities. A wealth of details on your rotator cuff operation, including videos, can be found using your favorite search engine, including muscles of the rotator cuff, surgical techniques, and rehabilitation procedures.